from the skin. Somatic sensation. And we said we have different types of somatic sensation, but transmitted through two important pathways: dorsal column tract that transmit fine touch and proprioception, and spinothalamic tract that transmit pain, temperature, old, and crude touch, new. And we said that the crude touch transmitted in the anterior or ventral spinothalamic tract. Fibers, excellent. Fibers are A delta fibers. And the pain transmitted through lateral spinothalamic tract with the temperature. And we have two types of pain and two types of fibers that transmit pain. Fast pain transmitted through A delta fiber, slow pain transmitted through C fibers. Okay? Right. Dermatomes, that every segment of the skin will transmit impulse through certain segment in the spinal cord and will project to certain area in the cortex. So there is segmental projection of the whole body on the central nervous system, on the cortex. Dermatomal representation. This section of the spinal cord showed the posterior horn, which is the substantia gelatinosa of Rolandi. And we mentioned this, there is lamination, layers from layer 1 to 6. And in this area, there is important synapse of the pain, temperature, and touch. Important synapse between the first and second neuron. This area is very important, and we are going to discuss it later in the control of pain. So this is the posterior horn, and we have proprioception and fine touch through A beta fiber, go up in the dorsal column, and crude touch and fast pain through A delta fibers, and pain, slow pain, and temperature through C fibers. Okay? Right. Thermal sensation or temperature sense. ايه السنسيشن ده؟ يعني ايه الستيمولس بتاعه؟ stimulus of thermal sensation. ازاي تحس ان في اختلاف في درجة الحرارة؟ ايه الستيمولس؟ الستيمولس temperature will affect the metabolism. So if there is decreased temperature, there is decreased activity, decreased metabolism of the receptors. So it stimulates certain specific receptors as cold sensation. If there is increase in temperature, increase in the activity of the receptor, increase the metabolism, this heat sensitive receptor will feel hot sensation. So hot and cold sensation is metabolic change in the receptors. We have 4 types of thermal sensitive receptors. First, cold receptors, and they are more numerous than hot receptors. عدد الريسبتورز بتاعت cold more numerous than hot receptors. So we have cold sensitive receptors, hot sensitive receptors, and we have 2 additional thermal sensitive receptors, hot associated with pain, يبقى hot pain sensitive receptor, وفي cold associated with pain فبنسميه cold pain receptors. Okay. طيب. The maximum, the range for cold sensation عليك السلام